Yeah, cancer is a disease, and it's known to the people and to the society as a serious disease. But a lot of people, I think, don't understand what it is exactly. What happens is that, the normal cells in the people keep dividing all the time, and that's normal. And they keep replacing the cells that die. But what happens is that at one stage and at a specific period of time, is that there is a genetic mutation. There is an abnormality within the genes inside the cell, and that makes the cell divides without any control from the body. So it keeps dividing, no control and no limitation. It's an abnormal division, and that makes up millions of cells that make a tumor. Well, I think the most important cause of cancer in the world is probably smoking. Smoking does not only cause lung cancer, as many people know, but it is responsible for about 15 types of cancer: lung, mouth, throat, larynx, kidney, and many other cancer types. It has been shown that at least 15 types of cancer are related to smoking, and also, pollution and fatty meals, and probably additives in meals, some chemical carcinogens that we get exposed to either in the environment or in food, radiation, ultraviolet light, genetic makeup or family history of cancer, and so on. The common cancers in the world are breast, prostate cancer, lung cancer, especially in the West. And then we have some specific areas. They have specific types of cancer, like liver cancer in Africa, for example, and AIDS-related cancer in some countries that have a lot of HIV infections. When it comes to Saudi Arabia, the most common cancer is breast cancer, representing about 1/3 of all cancer types. And colorectal cancer is the second most common cancer, and it's the first most common cancer in men in Saudi Arabia. And fortunately, liver cancer, which was very common, is decreasing a lot now. And that's because, and these are the good effects of vaccination against hepatitis that started about 15 to 20 years ago. Yeah, I think people should understand there are different specialties. We have a specialty called medical oncologist, and that's the doctor who treats cancer with drugs. Mainly, he makes the diagnosis, he makes the follow-up, and he treats it with drugs. We have a radiation oncologist. This is the doctor who specializes in treating cancer with radiation. He's also a clinician. And then we have a specialty that's really confusing, and it's called clinical oncologist, not medical oncologist like the one I talked about. And that means he is the doctor who's trained in both medical oncology and radiation oncology. So he prescribes radiation and he prescribes drugs. Then we have a surgical oncologist, and that's a doctor who's a surgeon and who is experienced and trained in removing cancer in the operating room. And he's a clinician, he follows patients up in the clinic and so on. And then we have another oncologist who is palliative care specialist, and that's an oncologist that deals with patients in their terminal life, and he makes sure that they have good quality of life and that they are comfortable. So these are the main subspecialties of cancer physicians. Other hospitals in Saudi Arabia are very advanced and well developed. We have 13 provinces in Saudi Arabia, And we have hospitals that covers the whole geographic area in Saudi Arabia. And we have many hospitals that are specialized in cancer, and they get referral from peripheral areas. But at least we have a specialist hospital in Jeddah, we have in Riyadh, we have in the south, we have in the eastern province, and then we have all the military hospitals and National Guard hospitals. They also are specialized, and they have cancer units. Screening is a very important issue in cancer because one of the key factors in the outcome of cancer is time. It makes a big difference when you discover cancer early. For example, breast cancer. If you discover the cancer early, if it's, which means it's probably stage 1, or it is even less than that, like in situ carcinoma, then the chance that the woman is going to survive 5 years is about 95 to 98%. And if it's late discovery, and the lady is already in stage 3 or 4, her percentage and likelihood of living for 5 years, it comes down to 15%. So it's very important is the time and early. So the best way is to look for cancer before it leads to symptoms. Otherwise, it's going to be too late. So we have to find out when cancer starts in a woman before she complains about it, because by the time she complains about it, it's already too big and advanced and probably have spread. So we have screening that's well developed for breast cancer by mammogram. We have for colorectal cancer by endoscopies and CT scans. We do prostate screening also. We do cervical cancer screening by pap smear, which is a very simple test that you do for the woman. And we have also screening in some patients, some subjects, if they are smokers, by CT scan for the lung. And all of these, the whole principle is to discover the cancer before it becomes symptomatic.